Are we dosing antifungals right in ICU patients? The SAFE ICU study asked a critical question: do current antifungal doses reach therapeutic targets in critically ill patients? Until now, most data came from small or single-center studies with limited generalizability. SAFE ICU was a prospective multi-center pharmacokinetics study. It enrolled 339 ICU patients from 30 centers across 12 countries. Patients receiving common antifungals like fluconazole, voriconazole, echinocandins, or amphotericin B were included. Blood samples were taken twice during therapy and analyzed centrally to calculate drug exposure using area under curve and C-min. The team assessed whether each antifungal met predefined pharmacodynamic targets. This table summarizes the pharmacokinetic target attainment of various antifungals in ICU patients from the SAFE ICU study. Fluconazole had good target attainment, above 80%, in both treatment and prophylaxis groups. Voriconazole and posaconazole showed poor performance for treatment, with less than 60% of patients reaching targets, especially early in therapy. Isavuconazole had better results later in the ICU course, but initial attainment was poor for prophylaxis. Among echinocandins, caspofungin had the highest target attainment, over 80% across time points, followed by anidilafungin. Micafungin, however, had lower attainment, especially for prophylaxis. Liposomal amphotericin B showed the lowest overall target attainment during treatment, below 60%. These scatter plots show drug exposures for various antifungals used in ICU patients across days 1 to 3 and 4 to 7. Fluconazole met the PK/PD target in most patients, but with wide variability. Voriconazole, posaconazole, and isavuconazole frequently fell below target levels. Micafungin and amphotericin B also showed inconsistent exposures. Caspofungin and anidilafungin had relatively better target attainment, especially against Candida albicans. Overall, many patients failed to achieve therapeutic targets, especially early in therapy. The limitations are: the study used predefined PK/PD targets, some of which are not universally validated. Only 26% of fungi had MIC values available, making it hard to individualize therapy. The take-home message is SAFE ICU gives us a wake-up call. Standardized dosing may not be safe or sufficient for critically ill patients with invasive fungal infections. Future work should include better MIC tracking, explore loading dose strategies, and evaluate drug levels in special populations like those on CRRT.